What if I told you that you could start a career in healthcare data, that you could land a real analyst job, and that you never have to pay for a course? And yet, almost nobody knows the actual real roadmap to this. But once you understand it, everything clicks. Let's break it down. So first, let's talk about what a healthcare data analyst actually is and what you can expect to do on a day-to-day basis before we dive into everything else. So a healthcare data analyst plays a very important role in healthcare systems. On one side, they're dealing with raw, messy information from electronic health records, claims, and programs. And on the other side, they have to deal with real decisions that impact patients, money, and quality of care. So as you can see, their job is super important, to say the least. When I was working as a clinical data analyst, my job was to take messy information and clean it, find patterns, and then turn that into clear, actionable insights that doctors, nurses, executives, program managers could act on. And I wasn't just sitting here making pretty charts. I was actually answering very important questions like, are our patients getting follow-up care on time? Which programs are actually working? And which ones are just quietly wasting us money? When you do this job well, you can make an impact on how an entire organization takes care of people. And so I'll give you a little bit on what to expect day to day. You start with a question from the business. Maybe hospital readmissions suddenly went up. Maybe the leadership just wants to know if they are hitting their goals for the year. So from there, you log into the data warehouse and then you write SQL, pull exactly what you need. And then you bring that into Excel or directly into a tool like Tableau or Power BI to clean and then transform that data. And so what you're essentially doing is that you're fixing missing values, weird data formats, inconsistent codes, and then even duplicate records. And so you build summaries, trends over time, and comparisons between different hospitals, providers, or patient groups. And then the fun part is you design a report or dashboard that answers the original question in a way that somebody with zero technical knowledge or background can easily understand that in seconds. What a lot of people tend to overlook when it comes to this job is that you really need to have really good communication skills. You're constantly meeting with stakeholders, clinicians, and managers, and what you're doing is you're explaining your findings and helping them decide what needs to change. And a lot of it is really just turning complex queries and dashboards into a clear story, asking the right follow-up questions, and making sure everybody that you're meeting with understands exactly what the data is saying and what actions need to come next. And to put it simply, as a healthcare data analyst, you are translating data into real decisions in healthcare. And honestly, the best part is you're really making an impact on the lives of patients. And to me, that's really valuable. So let's talk about skills, because this is where a lot of people get overwhelmed, and rightfully so. There's so many skills to learn. To break into healthcare data analytics, you do not need to be a master of every skill. Keep that in mind. You simply need a solid foundation in a few core areas like Excel, SQL, and then one data visualization tool, basic stats, and then just basic understanding of how healthcare works in the real world. So first, SQL. And SQL is a non-negotiable if you want to work with real healthcare data. Your goal at the start is not to master every single complex window function. Just the goal is to get really comfortable with the fundamentals, selecting columns, filtering with where, joining tables, and then grouping and aggregating the data. And for this, there's a bunch of free resources online. SQL Bolt is a great website. Data Lemur, Alex the Analyst is great on YouTube for explaining the basics of SQL. And if you have the ability to write clean, readable queries that join a few tables and answer clear questions, then you're already in a really solid place. Second skill is Microsoft Excel. So Excel, outside of SQL, is probably the tool that you will touch the most, especially early in your career. For this, you should be comfortable with cleaning the data, using filters, pivot tables, basic formulas like SUMIF, COUNTIF, VLOOKUP, XLOOKUP, and then just being able to build simple charts. And again, for this, you do not need to know every single advanced function. And a great way to learn Excel is just to go through walkthroughs and working with real large data sets. Skill number 3 is a data visualization tool. And you need at least one tool to turn your clean data into dashboards and reports. And in my case, that was Tableau, but you might also prefer Power BI, and that's totally fine. That's another great tool. Start off by learning how to connect to the data, build bar charts, line charts, simple tables, and clear filters so non-technical users can understand the data. Tableau Public and Power BI Desktop are free to download, and there are tons of step-by-step tutorials where you can follow along with example data. And the fourth skill is basic stats. So for this, you just need a good understanding of concepts like averages, medians, percentages, and trends over time. And then basic ideas like correlation versus causation. There's tons of free videos online on Khan Academy and YouTube where there's more than enough to get you at least started. So focus on understanding what the concepts are and do not just memorize the formulas. Don't do that. And finally, healthcare basics. So this is the part that a lot of people skip, but it matters a lot. And if you want to work in healthcare, you should be familiar with terms like EHR, claims, diagnosis codes, and basic care settings like inpatient, outpatient, and home care. You should know that an EHR is where clinical data lives. Claims data is about billing and reimbursement, and then quality measures tells us how well patients are being cared for. I have a bunch of this valuable information on my website, Informester.com, and then trust me when I say this, knowing healthcare basics really comes in handy, especially when you're talking to clinicians and stakeholders, or even your future boss. The most important thing that I want you to take away from this section is that you do not need to master everything. So get to a solid beginner to intermediate level in Excel, SQL, and then just one data visualization tool. And then layer in some basic stats and healthcare knowledge as you go, and then build small projects to practice. Do not let perfectionism stop you. Remember that. You can grow into all of the advanced stuff on the job, all right? So the key is to be really good with the fundamentals. Start there. Now let's talk about the part that can really help you land a job if you do not have any internship experience. And this is where you can show employers that you can take real world healthcare data, you can clean it, you can analyze it, and then you can tell a clear story. And when a hiring manager sees that on your resume, it instantly separates you from everyone who just lists Excel and SQL. Let me give you 3 projects I would build if I were starting today. So first would be a hospital readmissions dashboard. You could take de-identified data that includes admissions, discharge dates, and then basic patient info. You can use SQL and Excel to calculate the readmission rates, then build a Tableau or Power BI dashboard that shows trends by month, by unit, and then you can even do it by diagnosis groups. The second would be a claims cost and utilization project. You can use claim style data with dates, procedure codes, and paid amounts, and then answer questions like which services are driving the most cost and how utilization changes across age groups or regions. And then this shows that you can understand both data and the business side. And then the third would be a quality and safety trends report. Work with event or incident style data and then track things like falls, medication errors, or late follow-ups over time. Turn it into a clean, executive-ready report with just one main page and then a few focus views. And let me tell you this, if you can talk through projects like these in an interview, you look like somebody who's already doing the job. And that's gonna impress your employer, your future boss so much. Now we're gonna talk about the part everyone cares about getting hired. And at this stage, you're not just selling your skills, you're really telling a clear story about who you are and why you belong in healthcare data. Here's how I would position myself if I were breaking into healthcare data analytics today. I would frame everything around one simple idea. I help healthcare teams make better decisions with data. And then on your resume, that means every bullet should connect tools to outcomes. So instead of writing I used Excel and SQL on large data sets, you want I used SQL and Excel to clean and analyze patient data so leadership could track readmission trends. You are basically showing three things at once: the tool, the type of data, and then the impact. And then don't even worry about having an analyst title. Pull out anything that looks like data work reporting, tracking, process improvement, working with metrics, or supporting a team with numbers. Then rewrite those experiences using the same language you see in healthcare data analyst job descriptions. And make sure your portfolio is in front and center, and then put project section high up on your resume, and then include links to your hospital readmission dashboard, claims cost analysis, or any other project that you might work on. And trust me, when a hiring manager sees real healthcare style work, you instantly look way more serious. So with all of the important information wrapped up, I just want to take a moment to have a little bit of real talk with you. So I know all of this information can feel really overwhelming. There's so many things, and you're probably wondering, where do I even start? I'm here to tell you that I was once in your position too. I didn't have any internship experience, and I still found a way to position myself to learn those skills consistently, and just kept a really positive mindset that if I dedicate a couple hours per week, I can eventually get to where I want to be. And you can do the same thing too. So I'm just going to tell you that it is a little bit of a long journey, and you have to be realistic. Set a couple months aside, learn these skills, and you will become a healthcare data analyst. It's possible. Whether you're a student or somebody who just wants to change their careers, I'm here to tell you that it really is possible. And if I can do it, then anybody can. So just take a couple hours per week, 5 to 10 hours per week, and dedicate yourself into learning these skills: SQL, Excel, Tableau, communication skills, and then really just work on your resume, work on those projects, and you will get to a position where you can apply for these jobs. If you enjoyed this video and found it valuable, hit that like button and hit that subscribe button. I'm going to be making tons of more healthcare data related videos. My name is Sharif, this is Infomesser, and I hope to see you on the next video.